Kind of shifting gears a little bit. So conventional Western therapy often doesn't really take the variability of immigrants and their cultures into consideration. And you have experience working with diverse populations, including low SES and immigrant communities. And so, how do you think that culture influences mental health treatments? And why do you think that what do you think that experts should keep in mind when working cross-culturally?
Yeah. Yeah, that's a good question. It is something you need to keep in mind. I mean, certainly here in South Florida, where we have so many people who descend, if if they don't come themselves from Latin America.
Mhm.
So um I do have one patient, who talks to me about this subject often in regards to what he came for help with. He's from Venezuela, and he often tells me about how he feels about certain beliefs that people have about relationships are like very culturally dependent. So I mean, in general, you need to keep those things in mind because they're important to people you work with, to patients. But I think, you also need to keep in mind, of course, how like something like that can become a kind of shield, for the person not to look at themselves as deeply as they may need to. Humans, we can hide behind all sorts of things, including justifying that certain ways of thinking about or certain ways of behaving are culturally acceptable. Um, but so I mean, that's an issue that comes up a lot with people.
Yeah, no, I completely understand.